Joining us today is Andrew Harding, Emergency Department Pharmacist, Austin Health, who will be speaking at IIR's Reducing Hospital Readmissions and Discharge Planning Conference, 26th to 27th of July in Melbourne. Hello Andrew, thanks for joining us.
All right, thanks James.
Firstly, what do you believe to be the main issues currently facing emergency departments when it comes to the issue of readmissions?
Well, EDs are busy places, as we've all read. There are growing numbers of patients coming in every day, and a lot of them are readmissions. So we see patients that we all know and go, oh yes, we saw them yesterday, or we saw them the day before, we know them. So readmissions are an issue.
How can a pharmacist in ED reduce hospital readmissions?
There's various ways, and in the presentation that we have, I'm going to go through some of those, where it may be something simple as education. Someone who's come in a dozen times with poorly controlled asthma, and then by the time the pharmacist sees them, we have a chat to them and realise they're not even using their Ventolin, their medication, via a spacer, a device to help them use it correctly. So we can advise them on that, and there's a few patients that I can say we haven't seen since then, because we'd like to think they've gone away and they're using it correctly and hence prevented a readmission. That's one example. Other examples would be where we have patients who come in with, say, AF, so they've got a condition that's brought them into hospital, but part of that is they might be at a higher risk of something else happening, like a clot, which of course can lead to a stroke or heart attack. So advising the medical staff and the team looking after them that we should put them on some sort of secondary prevention to prevent them having those complications and hopefully prevent them coming less often to the departments. We have a role in doing that sort of thing. ED physicians are very good at diagnosing a problem and fixing the problem, but sometimes the cause of the problem might be something that could bring someone back to hospital. An example of that could be where they've come in with a bleeding disorder, they're on warfarin for whatever condition, and they have a high INR, which is their blood test, which is determining on how thin their blood is, and they've come in for a bleed, and then comes into ED, they get reversed, they get the warfarin reversed, and they're bleeding under control, but then they're ready to go home, and then by then we start to get involved, and then we realise that there's a new medication that started a few days ago or a week ago that's causing this condition, which they would have just gone back home on and had the same problem and come back. So I'll be presenting a case as well at the upcoming seminar, which highlights an example of that. There's some examples anyway.
Once you've successfully reduced such readmissions, do you then subsequently set up any sort of guidelines or such like in the department?
There's some things there are, like chest pain, which we have a chest pain pathway. So when someone comes in with chest pain, if it turns out to be it is cardiac in nature as opposed to they've just got a muscular problem, there is a pathway that they'll follow, that yes, they need to take this medication or have this test and go and have this done as a consequence of their admission. That's an example of a pathway to prevent readmission. There's plenty more. So yes, that's the original question.
You're speaking at IIR's Reducing Hospital Readmissions and Discharge Planning Conference, 26th to 27th of July in Melbourne. What are some of the other aspects you'll be covering in your presentation?
Well, basically the title is going to be How Does a Pharmacist Help with Overcoming Some of These Issues. I'm going to give an overview, some of the things I've just talked very briefly about today, some pain management, how to involve consulting with particular patients, how to involve medication review, and with each of the sections of the talk I'll be giving examples of how we've prevented some readmissions.
And finally, how do you think that delegates will benefit from attending an event such as this?
Hopefully they'll get an idea of what a pharmacist can do in their department, if they're from an emergency department, but even if they're not, how some hospitals who haven't even looked at the possibility of having a pharmacist in their department, how that could reduce their readmissions and representations to their hospital.
Andrew Harding, thank you very much for your time.
No worries. Thanks, James.